Hi, I'm Chet Marchwinski, Communications Director at the nonprofit Lean Enterprise Institute, and I'm at our annual Lean Transformation Summit in Nashville, Tennessee, as you could probably hear. And today I'm talking with Jeff Thompson, MD, who is Executive Advisor and CEO Emeritus at Gunderson Health System, a network of hospitals and medical facilities in Wisconsin that's named among the top 5% in the U.S. He is the former CEO at Gunderson for 14 years. He also is an intensive care pediatrician and author of Lead True, Live Your Values, Build Your People, Inspire Your Community. He has spoken at Stanford University, the Harvard School of Economics, the National Academy of Sciences, and today he's talking with us about value-based leadership. Welcome, Doctor. Thanks for taking the time.
Thank you very much for inviting me.
Now, values-based leadership sounds like a noble idea, but what is it, and what's the business case for it and the connection with a lean transformation?
Well, thanks. I've worked with many great leaders over the years, and I think one of the most consistent pieces that is both sounds good, as you mentioned, but is strategically sound, is to have the courage to define a set of values that you're going to live by, and then actually live by those values in all of your major corporate, individual personnel, financial, and tactical decisions. So to develop a plan based on values, not on a financial target, but on values, will result in tremendous financial success as well as serving the mission of the organization.
Okay. Can you give us an example of how you've done that or some other organization has done that?
Sure. When we built our strategic plan, we developed a purpose to improve the health and well-being of the community. Okay. We didn't say hit a margin. We didn't say grow and beat the competition. But we knew that having strong finances, taking out waste, being more thoughtful about how we used resources was going to help us serve the broader community. To engage your employees, to inspire your employees, they'll be much more inspired about we're going to lower the cost of care for our whole community and help businesses than saying, well, I want to move our margin from 2.5% to 2.73%. Not very inspirational.
Yeah. You've also noted that leaders must get close to the work to feel it's important and a moral imperative. But as a CEO of a big hospital and healthcare system with thousands of people and patients, how'd you do that?
Well, this is, you do it as a team. You know, you don't do it by yourself. You do it as a team, but you make it a priority. And when vice presidents would say, well, I really don't have time to go to my areas, I'd say, let me see your calendar. I'll get rid of a bunch of stuff to get you out there. But so we had a scheduled time, 8 o'clock in the morning, was get out of your cubes, go out and walk the area, talk with your people, find out if they have the resources they needed. I would go to every part of the organization once a year. I would have open mics, let them ask any questions. It helped reinforce this common theme of why are we here? We're going to improve the health and well-being of patients and communities. We're going to do it by building a great place to work.
So you were walking, you were out there
visiting. Absolutely.
Okay.
I went out there and then have open conversations. And then if they saw me, if they met me, they would tell the rest of the billing clerks or the nurses that I was there. Yeah. And so you didn't have to meet every individual employee. But then when I sent out my emails, they would actually read them, oddly enough. It was also very important that the whole senior team lived, acted, and was as consistent as possible in following the values of the organization. Once that became a norm, once we had a code of behavior, it was remarkably easier to improve the organization, to improve behaviors in the organization, and move things forward.
That's interesting. Just to follow up a little bit, when you went to these areas, what did you do? Did you ask questions?
Yes. Well, I would go. I would ask questions about how they're. It certainly wasn't a walk by and throw my hand in the air, say hi, and leave. It was sit down, ask them, do they have the tools? Sometimes I'd go right into the workplace with a billing clerk. What are you doing today? What are you working on? What's your biggest frustration? Sometimes it'd be to small or medium-sized groups where we'd sit down. I'd give them 10 minutes on the state of healthcare, 10 minutes on how Gunderson was doing, and then 40 minutes they asked any question they wanted. about anything related to the organization, their jobs, or anything else. So did it take some time? Yes, but it was absolutely worth it. It is, in the short term, leaders might think they don't have the time. In the long term, it was immensely valuable.
Sounds like it. Finally, what's something that an executive or a leader out there who's watching this can start doing differently tomorrow to switch from the traditional idea of leadership to values-based leadership?
Yeah, I think the first thing is to take a look at those set of the values and say, how do we organize ourselves so everyone knows what our values are? Have the courage to declare what those values are, have them on part of every application, every interview, every orientation, every annual review. Here's what our values are, and then have the courage to stay with implementing them. It takes a lot of discipline, but stay with implementing them regardless of whether it's a senior person, a valued engineer, the biggest salesperson. You have to stay with it and live those values all the time. If you do that, then the momentum to do better will come pretty quickly.
Okay. Dr. Thompson, thanks a lot for sharing your insights about how to manage and lead. Appreciate it.
Thank you very much for the time.
And thanks for watching. If you want to learn more about how to benefit personally and professionally from values-based leadership, visit jeffthompsonmd.com. One word, jeffthompsonmd.com. Thank you.